Meantime, the lack of a specific set of demands from the Occupy movement has been an underpublicized benefit contained within it. The protests' range is thus anything but finite. In our third story on the countdown, today Occupy Wall Street focused on health care, a march to the headquarters of Empire Blue Cross and Blue Shield, then to WellCare Health Plans, the Medicaid fraud people, and finally to St. Vincent's Hospital. This was a charity facility, the kind Michelle Bachmann just said we needed to have to take over for all government medical aid. It was founded in 1849. It closed last year because its owners demanded it make money, and it couldn't because of, you know, the charity part.
Healthcare for 99 cents. Healthcare for 99 cents. What do we need? Healthcare. When do we need it? Now. What do we need? Healthcare. When do we need it? Now.
A member of the protest group, Dr. Kenneth Weinberg, spoke to reporters.
I'm an ER physician, and every day that I go to work, I see the outrage, the horrors of what happens to people because they don't have health care. They can't get their prescriptions filled. They can't get follow-up. They can't get procedures done. And I've been seeing it for so many years, and it just sickens me.
I'm joined here now by Dr. Steven Auerbach, a member of Physicians for a National Health Program who spent a couple of days in Zuccotti Park this week, and we thank you for coming up.
Well, thank you for having me.
Explain the cause and effect, we'll start with this point, the cause and effect between Wall Street and things like St. Vincent's Hospital being shut down.
Sure. Well, we have such a fragmented system, or I should say non-system of care in the United States. So hospitals, we have a whole bunch of hospitals all the way up the east side of Manhattan. Now with the closure of St. Vincent's, there's no hospital on the west side below 57th Street. So we have this fragmented system where the wrong hospitals shut down. They were a great service community hospital. And the problem, as you were saying, is it's now profit, profit, profit. Right. Companies have to make this quarter-on-quarter profit to meet Wall Street expectations. If we had a single-payer, universal health care, Medicare for all, as it were, then what would be happening is everybody would be paying in, and you'd have a universal insurance pool, an all-American insurance pool, that would be covering everybody. It's been analyzed by the GAO, by the CBO, by the Commonwealth Fund, and everybody agrees. It's economically, it makes the most sense. Policy-wise, it makes the most sense. The only problem has been the power of the corporations.
Well, and that obviously raises the question that was so prominent in 2009 and early 2010, which is, do the drug companies and the insurance companies, the healthcare cartel, do they have too firm a grip on this part of an economy, which is they see their lifeblood, for us ever to shake that grip loose?
Well, never say never. We're still fighting the good fight. In fact, polls have shown, mainstream, regular polls, Washington Post, CNN, New York Times, show 65% of the American people would support single-payer Medicare for all. A recent study, academic, peer-review, professional study, published showed 59% of American physicians would support it. We're as tired of the for-profit health care insurance companies, the fragmentation, the paperwork, the duplication. People go on insurance, people go off insurance, the churn. What is it today? I've got 50 different forms. It makes no sense. Right. And no other country in the world does this except for the United States.
All right, so why is Physicians for a National Health Program, or healthcare program, why are you associated with Occupy Wall Street? My understanding was, from what I've seen on CNN and places like that they're a bunch of dirty hippies down there.
Oh, and,
gosh. You appear to own a tie, sir. What are you doing? What is your organization associating yourself with these folks?
Well, you know, if you actually go there and walk through, you'll see folks from all walks of life, young and old, professional, business suits. Let's face it, inequality kills. Poverty kills. Wage stagnation kills. It makes us and the U.S., us sick. So, of course, physicians are supportive of Occupy Wall Street. You know, it really is the same issues of economic inequality and disparity, stagnation for the most of us, and, frankly, the broken, corrupted political system. So it's really all the same issues for the Occupy Wall Street 99%. as those of us fighting for real healthcare reform have been fighting for all along.
Have you interacted a lot with the leaders? Is it difficult? They get very offended by the term leaders, but have you occupied with a lot of the people in the forefront of this? What's your experience been like?
Sure, we've absolutely worked with the process that they've had. So we've been at various meetings. There's different work groups. Our march today was consensed by the whole group, by the New York General Assembly as part of their official, such as it is, march for today. You know, we're all in this together. It really is the same fight altogether. It's the inequality, the wage stagnation, the income stagnation for the most of us. And, you know, in health care, we refer to this as health disparities,
right,
as the social factors that cause problems for health care. So people are more likely to get sick when there's poverty. There's more likely to get sick when there's inequality, and they're less likely to be able to get the care. So, of course, we're for it.
Poverty kills. Dr. Steven
Absolutely.
Auerbach of the Physicians for a National Healthcare Program, many thanks for coming in.
My pleasure. Thank you for having us.